Chances are you or somebody that you know suffers with migraine. It's a debilitating headache that just stops you in your tracks. But new research shows a better way to diagnose migraine and eventually treat it.
My migraines are pretty severe. It's a lot of physical pain in the sense that lots of pressure on the sinuses, even at the base of the skull, nausea, brain fog.
I can't work, I can't get out of bed, I can't lie down. It's like a pounding effect in your head, your ears are ringing. You really can't do anything. They're on a scale of 1 to 10, I would say about a 10.
How prevalent is a problem with migraine?
If you have 4 people in a room, at least one of them will have migraine. It is the leading cause of disability from a neurologic condition. And just in the US alone, it costs upwards of $20 billion with a B dollars a year in terms of lost productivity, direct costs of healthcare, and so forth.
Those of us without migraine, how debilitating is that headache?
Nobody gets a little migraine. It ruins people's lives. It ends marriages. It costs people their jobs, their relationships. It's horrendous.
So your study, your research, what kind of light does that shine on migraine in terms of diagnosis and treatment?
Right now, there is no marker. In other words, we can't do a blood test or an image that will say, oh, you have migraine. So it's a clinical diagnosis. So what we've done is we've tried to take a different approach to how we classify migraine. We've looked at functional imaging to see if we can identify differences in subgroups of people who get migraine. Then we've started looking at biomarkers, small molecules in the blood and in the spinal fluid that are different in subgroups in terms of looking at levels of epinephrine or dopamine or serotonin that might help us predict which patients are going to respond to which medicine, which patients are heading for trouble, which patients are stable. And then lastly, we have a group that is looking specifically at as much clinical information as you can get. When you have your periods, what your sleep cycle is like, how you respond to stress, when you eat your meals, what the pain feels like, where is the pain, how long does it last, how many years have you had this pain. So it's a huge database using what's called a large language model to do predictive modeling. And what we found is that, in fact, we do see 2 distinct groups that do not correspond to whether you have chronic or episodic. That's a pretty shocking thing to know, that there's another way of classifying headaches. I think that this is the beginning of a revolution in how we diagnose and treat people who have migraine.
So it's hopeful.
It's hopeful.
The knowledge and the information I'm getting from even my own physicians are, we can treat the symptoms, but in terms of long-term solution, there's still research going on about it. And so to see it progress, that's really, really exciting for someone like me who functions with it daily.